Thank you very much. I think we have a question from the mic over here. Can you identify yourself, and are you a social media user?
Sure. Juan Paramo. I'm from Miami. I'm I'm from the Committee of Young Surgeons, now known as the YFA. And you were very kind to invite us to participate actively in this conference. I have to say, this is the first time that I tweet. You know, I did have a Twitter account, and this is the first time that I've been tweeting and seeing all of my things up there. Very interesting. Now, there I am. Patients are not your friends. So, the question is, you know, I see this as really a social network, okay? And all of a sudden, I get a bunch of people that want to be my friend, you know, and they've never been my friends. So, like in Facebook, truly, you know, I have a Facebook account, and then all these people that were never my friends, all of a sudden they want to be my friends. So I say, no, I don't want to be your friend. And who has the time? Seriously, I mean, who has the time? You know, we're very busy. We have a busy schedule. We're taking care of patients. We're taking care of, you know, we're in the operating room. We barely get time to sleep. The interns are the only ones that now can sleep. So how does this really fit into your daily schedule? It's not that it's a waste of time, you know, I think that is very important, you know, for you to communicate with your friends, your true friends, but putting all of this up there, patient information and things like that, I think that is very unsafe. What do you think?
So, thank you very much, and I'm glad you lost your Twitter virginity here today, so that's good. I have to say I feel exactly the same way you do, and I thought last year when we were starting to put this panel together, although I had a Twitter account, I did not have a Facebook account, and I thought it was important for the college to have a Facebook account for this event, and in order for me to see the college Facebook account, I had to get an account, and I have had friends from the last 57 years of my life coming out of the woodwork wanting to friend me, and I just ignore them. I keep my Facebook account only for being able to get on the college account, and I'm sorry, but I do think it's good for us to have a social media presence, and you know, I think Twitter is a place where you can actually make value-added comments, and it's really not a place that you necessarily have to share your social life or your personal life with.
Gentlemen over here on the right.
I also lost my Twitter virginity today, even though I've had an account for 2 years. I have a simple question. So I accepted a Facebook friend, you know, because it had the name of a real friend from the past. And suddenly, oops, it was actually a patient that I don't accept friends from, patient friends. What is the most elegant way to unfriend this person?
I guess I'll take this one. Unfriending someone Facebook makes it hard to do, because the more connections you build, the more valuable your account is to them. You can send a message. When you click unfriend, you can actually include a personal message, but just so you know, they don't get unless you put the personal message in, they don't get the message that says you have been unfriended by, you know, this doctor. You should call his office and yell at him for unfriending. Their number of friends will go down. So if they're actively cultivating that number, you know, they know I had 207 yesterday and now I only have 206. Who's missing? I'm going to get him. Otherwise, there's no notification. There are notifications for a number of things. If you change your marital status, it's broadcast out unless you change that. If you change your sexual orientation, that's broadcast out. If you change your religion, that's broadcasted out. But unfriending someone is not broadcast out. So I would just drop them and be done with it.
As to it being elegant, I think one way to get out of a situation like that, which we shouldn't be getting into, but if you do, is to just say, this is for legal purposes. I would, you know, if you don't want to hurt their feelings, if that's the concern, it's elegance. This is for legal purposes. not safe for me to have this conversation with you as a patient, please call my office. But because truly it is for legal purposes, you should not have to worry about people getting offended. Just say, this is for legalities, I'm your doctor, I can't do this over social networking sessions. That should be okay.
On the left, I think, was next.
Red Alvarado, Rochester Hills, Michigan. I'm still a virgin. And
I think we got on the
Twitter. I mean, I know how to text, but this is, I'm here because I'm trying to learn stuff. But I've had, I realize this is a very popular thing, and there's post-op nurses that have asked me if they can build a fan page. Should I be afraid of that?
So there's no real need to be afraid of it. In information systems world, we have the concept of garbage in, garbage out. So if you just have a friend page that just has your office contact information, you can actually lock it down so it's basically like a yellow page ad.
So you're saying that I have to do all that? I mean, if they build a page and it
If
just kind of goes out
your nurses build a page on your behalf, there are a lot of default settings that Facebook has, and I mentioned in my talk, Facebook's not there for us to, make friends with high school friends from in the past. It's there for the connections that are made on Facebook are mined for ad revenue. So by default, Facebook wants people to be able to post video to your page and add comments to the things you post and all those things. So when you're creating a fan page, and send me an email if you need to talk about this later, but when you're creating a fan page, you need to turn all those features off. And at the school district, we do that. We don't allow people to comment on our postings that we make. We don't allow people to post things to our page's wall, which you can think of as like a bulletin board, in your office lobby. We don't allow people to do those things, but we had to actively make that decision. So if you do decide, you can have a presence that people can say, oh, I like this doctor's office, but that's the end of the interaction. So if all you're looking for is sort of a one-way yellow book ad, you can do that. Thank you.
On the right here.
Rich Olson, I'm also proud to be from Georgia, and I'm not going to disclose all of my virginity situation, but I've been on Facebook about a couple of years, Twitter just a couple of weeks, mostly getting ready for this session. I've really enjoyed Twitter, learning about it, following more politics than healthcare things, and look forward to doing more, and thank the college for having this session. But I don't know if I have to redo all of my Facebook or not, because I'm friends with high school friends, med school friends, patients, and I guess I'm mid-age, whatever, and I feel like I'm the same guy privately as I am kind of at work anyway. So I don't have an alternate life that I have to conceal from my patients, and it's worked out well. And what I found interesting that I'd like to share is I have an 80-year-old patient who has a blog. She has a son in New York who was in media and set her up, and octogenariansblog.org or com or net, whatever it is, you can go find her. And she's now friends with my high school friends in Minnesota, and they, I don't know what they're saying about me, and I don't really care. I think it's probably okay things, but maybe it's helped broken down some of the college surveys realization that surgeons can be aloof, and maybe if we just are seen by people as human, if we don't have any time, like the fellow says, to get out and just have a glass of wine with your neighbors or whatever, you can at least, I take about 30 minutes every morning, and it helps me wake up every morning, and then I go to work. And it's been really a great thing, I think, for my group of friends. So I don't know, I feel like it's possible to have friend relationships, even with patients, because we sort of have episodic care as surgeons. We can end the relationship once their stitches are out. It's not like an internist. So I don't know. I think it's possible to not violate ethics.
Thank you. Thank you for those comments. Any response from the panelists related to that?
I mean, I would just bring up, I would just bring up the concept of Facebook lists, because if you can leave all the settings the same way they are now, but if your hospital policy changes and you need to stop doing everything all at once, if your hospital says, we need you to conduct patient meetings through the phone, by taking the time ahead of time to segment people into lists, it'll make your life much easier in the long run.
I think your comments are very right on, because I can tell you after 22 years in a small community, we have about 1.2 million people. I can't walk out of the house without having families come up to me and thanking me for operating on their kids. So, or people coming up and showing me scars, exactly right. There probably isn't much of a difference between our public and private lives at this point. So,
Gentleman on the left there, I think.
I'm Mark Moskowitz from North Carolina. I'm pretty much a Luddite, but I'll just ask you a few questions anyway. The two concerns is I've used some of these, I've used them to communicate difficult problems with patients, etc. And the thing that I often use are patient pictures. Not face pictures, but the inside of bellies, the inside of groins, the inside of things that are not identifiable. And as I read the HIPAA rules and things like that, I don't know whether I am doing the right thing or the wrong thing, but probably this is one of the most valuable tools for me as a physician to learn. And the other question I have, which is totally unrelated, is the internet your friend? If I were to go look up Dr. Jones, okay, and I wanted to find Dr. Jones's article about colectomies, I'd write Dr. Jones colectomy, and it would be health grades, likeyourphysician.com, hateyourphysician.com, etc. So about 20 things before I got to his article. So how does social media affect this type of thing?
Good question. Sandy, Rebecca?
Well, on the first one, in terms of whether it's identifiable, it really comes down to the fact of that specific picture. I mean, is it really truly unidentifiable if there's not something in it somewhat in the eye of the viewer? But it sounds like from what you're describing, it probably is unidentifiable. But then a related aspect would be, who are you sharing it with? I mean, are you putting it on Facebook, or are you sharing it with a listserv of 20 colleagues that you consult with, or even within a physician-only type site? And all of those aspects are things to consider. So the first point would be, is it identifiable or not? And from what you're describing, it sounds probably no. If you're familiar with HIPAA, there is that safe harbor with lists, 18, I believe, identifiers, and some of them are, images can be identifiable. So it's very fact specific there.
What about the reverse? I was going to say for a sec, because I know probably many of the surgeons in the audience have used the camera on your phone to take wound pictures and have patients, if they're out in the rural area and they want to know how the wound is doing. I've used that many times. Are we pretty safe in that regard? So they'll take a picture of a wound, send it to us, we look at it, and then determine what needs to be done, follow with a telephone call.
Well, that's coming from the patient themselves.
Right,
they're sending you.
Yep.
Yeah, that's a different issue. I mean, they're sending it to you.
Right.
If you then turned it and put it on your Facebook wall, that would be a problem. But
Just wanted to confirm that was okay.
And of course, within the realm of, if you're in a treatment situation where it's part of a consult or actively part of treatment, that's part of HIPAA on its own. I mean, sharing of PHI within treatment and practice is permitted without patient-specific authorization.
Just to qualify, in more cases than not, it's either educational. We saw patient videos or pictures every lecture we saw today, and they're not just going to doctors. I just got to tell you that because you're here. And also,
I can see that.
and we also use them as patient education on our websites. Here's a picture of a hernia.
Well, presumably, hernia, or Mrs. Smith, when her hernia picture was taken, agreed that it could be used in that way. It would be part of the consent that we may use this for educational training. You're okay with that? That would protect that. Yeah, if you're putting images and really identifiable content in a video that's then being shared, even in an educational setting, get consent from the patient. Oftentimes they're willing to do that.